I just wish to say hi to all from wherever you are receiving us from, and just bring the following to your attention, that something interesting has happened today during our OET speaking class. And one of my students happened to ask the following question: Teacher Joseph, you insisted that for one to perform well in OET speaking, empathy is everything. And I said yes. Then this student asked me to elaborate a little on, so what should one do in order to improve on their skills to demonstrate empathy? And this presentation is therefore a response to what I've shared with my students. That unlike in so many other English tests, OET speaking is specifically assessing how doctors and nurses communicate, talk to patients. And in this case, it's very important for us to be empathetic, like we feel the position of the patient or their relative. In this regard, there are three most important things I think we can cultivate upon to improve on our techniques to show empathy to a patient or their relative the moment we are not only preparing for the OET exam, but also in our day-to-day practice in our career as doctors and nurses. And therefore, let me say that let's not think of these only in the context of the OET exam, because in addition to training and preparing for the exam, this should be something we should practice in our day-to-day activities, especially during our hours of duty. There are three things, therefore, which I feel and I think can really help us improve on our ability to show empathy. Number one is tone. How do you sound when you talk? Number two, vocabulary or choice of words. What kind of words are we using when we are responding to patients? Remember, the examiner or your interlocutor will be playing the role of their patient or their relative. 3 is what we may call facial expression, eye contact, and gestures. Let's look at the first one, tone. As much as we want to show empathy, attitude is everything. And therefore, we need to record our voices as we speak, be it on your laptop or on your smartphone. And then just play back what you recorded for you to hear how you sound when other people listen to your voice. The more you do that, you can even simulate a situation, even in your own bedroom, even in your own living room, even in the office. And then you assume there's a patient whom you're handling. And you're playing the role of the nurse and say something like, "Hello, Julie. Oh, how are you doing today? Oh, I'm happy to see that you've really improved." Whatever. Then play back and listen to your own voice. That is the best way in which we can do what we may call self-assessment of the quality of our own voices. The more you do that, the more you'll fix a lot of things that have to do with your voice, consciously and unconsciously. Again, it's also good to remember that when you are talking to a patient, in spite of the stresses that define and characterize the life of a nurse, in OET, you are being assessed of your character. And therefore, you may be facing a patient who is angry, unwell, in ways that they're not even able to express themselves clearly, and therefore you can shout at them. Remember, the tone you use to address the patient matters a lot, and therefore feel okay to make the patient feel that you understand their position. You can say this by just listening to how you put your voice. Sound calm, sound caring, sound loving. That matters a lot. When we come to point number 2, vocabulary, this has to do with your choice of words. You may not just sound nice, calm, caring, and loving, but your words are sarcastic. And therefore, it's good for us to cultivate the usage of words such as I'm sorry, understand, oh yes, it'll be well. You know, those kind of words that really make someone appreciate that you're understanding their position. Again, as much as we use those kind of words, it's also good to practice, preferably and probably even in front of a mirror, or even video shoot yourself and then play back to see how you are presenting in terms of your facial expressions, gestures, so that the 3 elements, tone, choice of words, and your facial expressions, speak to the patient or their relative, whom in this case will be your examiner or your interlocutor. For this and much more, feel free to join our OET online classes with Teacher Joseph. Wishing you the best.